We've all, thought about it, right? That moment, life throws a curveball, financially speaking. Maybe it's a friend hit the huge medical bill they just didn't see coming. Or maybe you heard about someone, thought they had really good insurance, but then bam, an accident and they're just swamped with debt. It makes you stop and think, doesn't it? How solid is my financial shield, really? Well, today we're doing a deep dive into exactly that, health insurance essentials. But look, this isn't just the 101 stuff. We want to unpack the strategy, the common traps, and the details that really empower you. Protect your health and your money.
Exactly. For you listening, folks who are already pretty sharp on personal finance, we're trying to cut through the usual noise, get to the insights that matter. Because fundamentally, health insurance is how you transfer massive financial risk. You pay a predictable amount to avoid, well, potentially ruinous costs. But really knowing how to use that tool effectively, that's the game changer.
Yeah, because we all know healthcare is expensive, but the sheer scale of it and how easily it can still catch you out, even with insurance, it's staggering. We're talking bills that can lead straight to medical debt, which, is still a huge reason for personal bankruptcy for many people. It's not just about paying for a doctor visit. It's about protecting everything else you've worked for.
Okay, so let's start there. That critical why. Beyond just needing care, what's the often missed point about how insurance protects your whole financial picture? Where do people kind of misjudge it?
I think it's underestimating the sheer size of the hit, even with coverage. If you don't fully grasp the terms, our sources mention some pretty stark numbers, like a simple broken leg could be upwards of $7,500.
Wow. A short hospital stay? Maybe 3 days. You could be looking at $30,000 easily. And something complex, like, say, cancer treatment, that can run into hundreds of thousands. No problem. The key thing here is these aren't just numbers on a page. This is real money, years of savings potentially, or debt that hangs over you for decades. If you don't understand your plan, you're risking a financial catastrophe, not just a medical bill.
And that's the real gut punch, right? Because having some insurance feels safe. But if it's not the right coverage or you don't understand it, you're still exposed. It's not just about getting treatment. It's stopping a health crisis from becoming a money crisis, which then affects, well, everything else. Savings, retirement, just the stress of it all. So what we're saying is this is more than a line item. It's like a strategic defense for your entire financial life against those big unexpected hits. But to build that defense, you need to know the language, okay? The jargon. Let's get into it. Most of you listening probably know premium, deductible, but where do people often get, tripped up? And how do these terms actually work together to impact your bottom line?
Right, this is where the deep dive really starts. Let's take premium. Everyone gets, it's the regular payment, usually monthly, just to have the insurance. But the strategic angle. Your premium isn't just the cost of entry. It's a lever you pull to manage your potential future out-of-pocket spending. Lots of healthy people go for low premiums, which makes sense, but they sometimes forget that usually means higher deductibles, higher coinsurance later if something happens. And with work plans, it's easy to gloss over the fact that your employer is probably paying a big slice of that premium. It's a hidden subsidy. Really.
So that upfront cost, the premium,
Yeah.
it's a trade-off. Lower payment now might mean a bigger shock later if you need care. Okay, talking about that shock, what's the biggest misunderstanding with deductibles? That feels like the first big number people see.
Absolutely. Most people know it's the amount you pay before the insurance starts paying more. But here's the tricky part. What actually counts towards it? Some plans, maybe many, don't count your regular copays, like for doctor visits or prescriptions, towards that deductible, even though it's money out of your pocket. So you could be paying these copays all year, thinking you're making progress on the deductible, and then wham, a big procedure hits, and you still owe the full deductible amount. It can sometimes, unfortunately, make people put off care until it's urgent, which just costs more for everyone in the end.
Right.
Then you get copayments or copays. Those fixed fees for specific things, right? Like $25 when you see your primary care doctor.
Yeah.
Paid right then and there. And coinsurance. That's the percentage you pay after you've met that deductible. The common 80-20 split.
Yeah.
Insurance pays 80%, you pay 20%. The key difference is when they apply. Copays are often upfront. For specific services, deductible status might not matter. Coinsurance. That only starts after the deductible is met, and it's a percentage of the total bill, not a fixed fee. Understanding how premium, deductible, copay, and coinsurance interact, that really dictates your immediate costs.
That's a really important distinction. Copay is flat, predictable. Coinsurance scales up with the cost, really shows why you need to know which applies when. But okay, what happens when all those percentages and flat fees start piling up? That's where the out-of-pocket maximum fits in, right? That sounds like the ultimate safety net.
It absolutely is.
Mm.
And probably the most critical term to fully understand. The out-of-pocket max is the absolute most you will pay in a single policy year for covered services. It includes your deductible, your co-pays, your co-insurance payments all added together. Once you hit that limit, let's say it's $5,000, your insurance plan pays 100% of covered costs for the rest of that year. 100%. No
Wow.
matter how high the medical bills go after that point, it is your financial firewall. Stops the bleeding, essentially. And this is a huge, but it generally only applies to covered services you get in network.
Ah, and that leads us straight into that often, let's be honest, frustrating world of in-network versus out-of-network. This is where a lot of those nightmare surprise bills come from, isn't it?
Precisely. In-network doctors and hospitals have contracts with your insurer. They've agreed on lower negotiated rates. Your costs with them count properly towards your deductible and that all-important out-of-pocket max. Go out-of-network. You're basically walking into a financial minefield.
Hmm.
Your insurance might pay way less, maybe nothing at all. You could be stuck with the whole bill. And the really tricky part, even if you go to an in-network hospital, sometimes a specific doctor there, maybe the anesthesiologist or radiologist might be out of network. You didn't even choose them.
Ugh. Yeah, heard those stories.
Leads to those surprise bills. So rule number one, always check if your specific doctor, clinic, and hospital are in-network for your specific plan. It's not just advice. It's like essential homework.
Okay, so we've broken these down, not just definitions, but how they connect, how they form this strategic puzzle. Understanding that interplay gives you real control. So
Wow.
how do we use this knowledge when it's time to actually choose a plan, especially when the options seem, well, overwhelming?
All right, this is where you apply those insights. When you're looking at plans, maybe during open enrollment at work or on the marketplace, don't just look at the premium. That's step one, sure, but not the only step. First, think strategically about plan types. What do you value more? Lower cost or more flexibility? HMOs, health maintenance organizations, tend to have lower premiums, but they usually have tighter networks. And you often need a referral from your primary doctor to see a specialist. Good if you like your primary doc and don't expect lots of specialist visits.
Okay.
PPOs, preferred provider organizations, offer more freedom. You can often see specialists without referrals, sometimes even get partial coverage if you go out of network, but you usually pay for that flexibility with a higher premium or maybe a higher deductible. Lots of people prefer these if they want choice.
Makes sense.
And then there are things like HDHPs, high deductible health plans, often paired with an HSA, a health savings account. Lower premiums, yes, but like the name says, a higher deductible. The HSA is the key part, though. It's a savings account with tax advantages, specifically for medical costs. So HDHPs can be really smart for healthy folks who can handle the higher deductible risk and want that tax advantage savings tool. It can grow over time, too.
That's a critical difference, not just HMO versus PPO, but thinking about your own health, your lifestyle needs. So when people weigh the premium against those potential out-of-pocket costs, what's the common slip-up?
Focusing only on that monthly premium number, you absolutely have to evaluate the premium versus your expected total costs. Like if you know you have a chronic condition or you take expensive meds or you just tend to see the doctor fairly often,
Yeah.
a plan with a higher premium but lower deductible and copays, that might actually save you thousands over the year. Yeah. But if you're generally healthy, rarely need care, that lower premium HDHP with an HSA could be much more cost effective. You save on premiums and you build up that tax-free HSA fund for if or when you do need care. It really requires you to be honest about your past health use and, make a reasonable guess about the year ahead.
So trying to predict the future a bit, health-wise, makes sense.
Yeah.
What's the next crucial check?
Non-negotiable. Check the provider network thoroughly. I mean, really check it.
You said this before, but it's worth repeating.
Absolutely.
Yeah.
Before you sign up, confirm your regular doctor, any specialist you see, the local hospital you'd prefer, are they actually in the network for that specific plan? If keeping Dr. Smith is your top priority, any plan that doesn't include her is off the table, period. Also, look at the network's breadth. Does it have good specialist coverage? What about emergency care if you travel? And don't stop there. Compare the covered services and, critically, the drug formulary. Plans differ on things beyond the basics: mental health coverage, physical therapy, maternity care. Look at the summary of benefits and the formulary, that's the list of covered prescription drugs. If you take any regular medication, find that list. Check if your specific drug is covered and what tier it's in that determines your copay or co-insurance. This can be a huge cost difference, especially for newer or brand-name drugs.
Yeah, a detail that could cost you hundreds easily.
Exactly. And finally, use the resources available and ask questions. Employers, marketplaces, they usually provide comparison tools. Use them. They often estimate your total annual cost, including potential out-of-pocket, not just the premium. Focus on that out-of-pocket max number, too. And if anything is fuzzy, call the insurance company's customer service line. Don't be shy. Ask direct questions. Is Dr. Lee my cardiologist? Definitely in-network for Plan B? Do I need a referral for every specialist? How does urgent care work if I'm out of state?
Being informed like that, it replaces anxiety with, well, strategic confidence. That's really great advice. Moving from just accepting a plan to actively choosing it. Okay, let's pull it all together. We've got the terms, the interactions, the choosing process. Can you walk us through a real-world kind of scenario? Show us how it plays out for someone.
Yeah, let's do a hypothetical. Let's say you chose an HDHP high-deductible plan because you're healthy, want the lower premium, and that HSA. Let's say your plan has a $3,000 deductible. Okay, and after that, you pay 20% coinsurance. And the absolute maximum you'll pay out of pocket for the year is $7,000.
Okay, got it. 3K deductible, 20% coinsurance, 7K max out of pocket.
Right. So the year starts. Maybe you have a couple of routine visits. Let's imagine your plan has a $50 copay for those, and maybe they don't count towards your deductible. So you pay those $50 copays plus your monthly premium. So far, pretty straightforward.
Predictable costs.
Yep. Then, March rolls around. You got this nagging back pain, need an MRI. You make sure it's an in-network facility. The MRI costs $2,500. Since your deductible is $3,000 and you haven't paid anything towards it yet, those copays didn't count, remember, you pay the full $2,500 to the MRI.
Ouch. Okay.
That $2,500 now counts towards your $3,000 deductible. So you've got $500 left on the deductible. And that $2,500 also counts towards your $7,000 out-of-pocket max.
Right. Making progress, I guess.
Exactly. A few months later, the back's still bad. You need a procedure. Again, you make sure it's in network. The procedure costs $10,000. Okay. First, you still owe $500 on your deductible. So you pay that $500. Boom. Deductible met for the year. Now, for the remaining $9,500 of that procedure cost, $10,000 minus the $500 deductible part, your 20% coinsurance applies. So you pay 20% of $9,500. That comes out to $1,900. Your insurance pays the other 80%, which is $7,600.
Okay, so you paid the $500 deductible balance, then $1,900 in coinsurance for that procedure.
Precisely. So let's add up your total out-of-pocket spending for the year so far. For covered in-network stuff, you had maybe a couple of $50 copays, let's say $100 total, plus the $2,500 for the MRI, plus the $500 deductible remainder for the procedure, plus the $1,900 coinsurance for the procedure. That totals, let's see, $4,900, plus your premiums, of course. But those don't count towards the max.
Okay, $4,900 out of pocket.
Right. And all of that $4,900 counts towards your $7,000 out-of-pocket maximum. So you're still $2,100 away from hitting that yearly limit. If you needed more covered in-network care later that year, you'd keep paying 20% coinsurance until your total spending hit $7,000. Then the insurance would cover 100% for the rest of the year.
That makes it so much clearer. It really shows how those costs can add up, even before you hit the max, and why just having insurance isn't the full story. You have to know how your specific plan works.
Exactly. And let me just stress this one more time. This whole example relies on everything being in-network.
All right.
If that MRI facility or one of the doctors involved in their procedure was out of network, the whole calculation changes. You could owe much, much more, maybe the full amount. It wouldn't necessarily count towards your in-network deductible or out-of-pocket max in the same way, or at all. That's the trap people fall into sometimes.
What a fantastic deep dive. Really feels like we've gone past the basics, looked at the strategy, the potential problems. End of the day, this isn't just about numbers, is it? It's about feeling empowered, making proactive choices, building that shield for your health, sure, but also for your financial future.
That really is the goal. When you have this kind of understanding, you can walk into open enrollment or looking at marketplace plans with real confidence. You're not just picking one, you're making a strategic decision that fits your life. And that brings, honestly, a lot of peace of mind. So maybe something to think about as you consider your own situation. Beyond just covering medical bills, how does knowing you're financially protected really impact other areas? your long-term goals, maybe your willingness to take calculated risks elsewhere? How does that deeper sense of security shape how you plan and live?
That's a great question to leave everyone with. Thank you for joining us on this deep dive today. We really hope you can take these insights, apply them, and feel more empowered by your health insurance choices. Until next time, stay well and stay strategically informed.